Hey legends, welcome to the podcast. This week we're chatting about rashes, and specifically we are chatting about petechial rashes and purpuric rashes that we may see in the emergency department. Now it's important to understand that our patient can come in with a range of different issues. However, we need to be mindful that these types of patients need a really good clinical exam. So it's really important that we clinically examine our patients from head to toe, and there always comes a clinical history that you need from your patient. So I always preface that before we start. Now, there's a few ways to remember petechiae rashes, and it's really important that we know what they look like. In the bottom left of the screen now, you can see a petechial rash. Generally, petechial rashes can be non-blanching in nature, and they can be seen in different parts of the bodies, under the roof of the mouth, eyes. They can also be seen on the chest or back. So it's really important that we examine our patients from head to toe. Now, if you want to remember petechial rashes and you really want to hone in, there's a little acronym I use. It's helped me as a clinician to remember them. And I remember HBVM, or huge BVM. That's the best way I remember it. So H is going to be your hematological causes. B is going to be your bacterial causes. V is going to be your viral causes. And M is going to be your mechanical causes of petechiae or purpuric rashes. So if we have a look here at hematological causes, they can be ITP, so your platelet levels that'll be off. The second one could be like DIC. DIC in children would be really bad. We wouldn't want to see that. And we'd be pretty worried if we saw a patient with DIC in our emergency departments as well. Malignancy is something that we'd think about if we saw petechiae rash as well. And probably the other one would be like, leukemia would be another cause. Bacterial causes, if we're moving on to bacterial causes. So some bacterial causes are going to be, like we said before, meningococcal being one of the things that we may associate a non-blanching rash. The other one's going to be strep, which we have seen in our EDs, and Haemophilus as well. Haemophilus is pretty sketchy. And group A strep as well. And staph infections, we have seen them a lot through our EDs. V, I remember V as viral causes, like your enterovirus is a real common one, adenovirus or influenza. Last week I saw an influenza A with petechial rash. And the last one is M, mechanical causes. So mechanical causes are vomiting, excessive vomiting or coughing. Don't ever forget things such as, injury or violence, especially like a strangulation or anything that could cause, pressure and flow through those carotid arteries or other arteries in the neck. So physical pressure towards the neck. The last one, there are other causes. HSP is another one in terms of not a mechanical, but just other causes of purpuric or petechiae rashes, and vasculitis or drug-induced thrombocytopenia. Anyway, that's the session. Have a great day. You!